As a kid I was discreet, undressed and leftward in a chamber for 3 days, says Clarissa, 24. Elegance, 25, says, I was really suicide, I didn't see any spot in residing. Both of Clarissa and Elegance include frontier identity disturbance, and they include consumable lot of the recent 10 years in and out of psychological public health hospitals. They are now on one of the at first psychological public health wards to leave practices such as moderation, solitude and fast tranquilization of patients, that are utilized to halt those in psychological illnesses of damaging by themselves. Both of youthful female are now so quite to get their at first feast in nearly 10 year. I hardly leftward my bed for a year upcoming there, currently I am up each date, we go out walk, to the shops, bathing 3 or 4 persons times a 1 week. It's fair a fully various lifetime. Clarissa says limiting practices, that she utilized to expertise routinely at some hospitals, get off all you've acquired. I was discreet, undressed, put in against ligature clothes versus my will and leftward in a chamber in 2 human beings observer me for on 3 days. In several places it's terrible since it is utilized as a at first refuge. Comrade patient Mariana, 21, says she was sectioned by the Psychological Public Health Act for the top portion of 5 year. One day I was transferred by my weapon and legs to a de-escalation chamber wherever I was discreet for 4 persons several hours, person downward in a bob pouch. I had personnel gasket on top of me, I was rushed in clinic, my flesh fair closed downward of scare, she says. Instead of moderation and solitude, the personnel on Springbank chamber, who patients explain as wonderful, use various techniques to supervise patients' stress, consisting attentiveness and a kind of speaking treatment. It teaches patients various ways of behavior in painful tension, that include previous leading in personality harm or suicidal attempts. Elegance says, down there is a lot of stigmatization about identity disorders. To me it brings on intensive tension how are difficult to monitoring, that might incite ego how you might wish to personality harm. She added how it might as well incite suicide ego, and some psychological public health problems love depressive, concern disorders and consuming disorders. The advisor in accusation, Dr. Jorge Simpton, and his crew of specialists transferred out study for the 3-year up limiting practices were eradicated, and the 3-year with, while dialectic behavior treatment was utilized. It crushed downward how to do specific things, how human beings get forgiven, that engage personal relations, emotion regulatory and stress toleration. We can all enhance our skills on every of those areas, if affliction of a psychological public health issue or no, he says. Results were drama, in a fall of 56 restraints a year to fair 6, and the virtual extermination of fast tranquilization, downward to fair 1 in the history 3.5 year. The methods are now creature utilized by the King School of Psychiatrists, for which it describes as one of the greatest quality assurance enhancement programs in psychological public health everywhere in the planet. Dr. Amar Chek, of the school, says they were flooded in customer requests to get portion. These wards include the highest use of limiting experience. Every of those wards are receive a lot of supporting to know the factors guideline to the use of limitation and to go up in their own ideas on which may do a distinction, and to testing them of. Our purpose is, above the following 15 months, to bring the use of limiting experience by a tertiary, he told. Recent December, the Secretariat of Country for Public Health and Public Thoroughness, Matt Signature, requested the Thoroughness Quality Assurance Committee to conduct out a overview of the use of limiting practices versus human beings in psychological public health problems, training disabilities and autistic. The at first paper will be published in May 2019.